Better Living with Liz Walker is brought to you by Partners Healthcare.
It's considered the gem of the Boston Theater District. Good evening, everybody. I'm Liz Walker, and this is Better Living. Tonight, we're on stage at Boston's 102-year-old Shubert Theater, long ago dubbed the Little Princess. We've been granted special access to this beautiful space, and access is the theme of our show. We're going to show you a few interesting things here, and we're also going to shift our spotlight from the stage out into Boston area healthcare institutions, where there have been dramatic advances in making healthcare more accessible. Every day, people from all over the world come to Boston to receive medical care that's considered the best in the world. Top-ranked hospitals, medical schools, research teams, and specialists abound in this city. What may not be so easy to find is a place to stay. That's why Boston's hospitality homes are so important. They provide short-term housing in volunteer locations that take a lot of the stress out of travel for patients and their families.
Well, Carol was diagnosed with having cancer of the tonsils and the lymph nodes. After her first round of chemo and radiation, her nausea shot up to about a level of 9 out of 10, so we needed to find an alternative of just not traveling.
Being able to stay here rather than make that trip is just amazing, because being in the car, being nauseous, and making that trip was just awful. And now from here, when we stay here, it's about a 15-minute walk if I'm up to walking, so I'm at least keeping myself moving, exercising, and not just still all the time.
If you ask any one of our hosts, what does this program mean to you, they'll tell you that they get more out of our program than our guests do. There's such a good feeling about making a family under stress feel better.
You know, I'm really lucky. I got this nice big house to myself, and I wanted to share it with people. So I got involved with hospitality homes, and I have had lots of wonderful people come by, and the blessings they have bestowed on me and my family. And it's so nice being able to help out people who are going through hard times.
Hospitality homes are the solution for out-of-town families seeking medical treatment. But what happens to a sick person who has no home? That's when the folks at the Barbara McInnes house step in.
I lost my room. The landlord changed the room and house over to an apartment building. So I lost that, so I was homeless. I fell on the sidewalk and the ambulance came and took me to Boston Medical Center across the street. And eventually I come over here.
The Barbara McInnes house. This is a place where people stay while they're getting treatment for illnesses that cause a person to be maybe not quite sick enough to need an acute care hospital, but they're clearly too sick to be in shelters or outside. Our program started off with this understanding that if you wait for people who are experiencing homelessness to come to community health centers or hospitals, by the time homeless people are able to make it into these facilities, they've really reached a point that they're very advanced. Our street team at Boston Healthcare for the Homeless program is a multidisciplinary group of healthcare providers, including physicians and psychiatrists, nurse practitioners, physician assistants, nurses, and caseworkers. And they do this by foot often, with sort of backpacks, carrying backpacks, and visiting people in the places that they've come to know them to stay.
This is just who we're looking for. Okay. I wasn't sure who it was. I didn't want to wake you up. I'm sorry. Hi, Keisha. Keisha, we want to get you in. Keisha was very much a part of the streets just over 5 years ago and going back about 10 or 15 years. And she would back then occasionally come into our old McInnes house. Safe, what's up?
Rob's out.
You're kidding. When did he get out?
2 days ago.
Have you seen him? Why don't you come into McInnes house? Why don't you come on in?
Homeless people have an extraordinary amount of problems with their feet, podiatric problems. And one way that we're able to sort of get our foot in the door, so to speak, with people who often have a hard time trusting medical professionals is by delivering foot care at our clinic at St. Francis House. Over time, we find that we're able to build relationship with folks who come back time and again to get that very basic and important thing taken care of.
Let's take a look.
We care for patients with severe dental problems as well.
It's not an abscess? Well, I don't see any. All right.
So the Barbara McGinnis House is a really unique program, not only in the country, frankly, but in the world. The way in which we work with patients who are experiencing homelessness really focuses on the little ways in which lives can change, getting a real understanding of what that patient is going through, and then making sure that we give access to that patient to get them into a safe place.
Bonnie was assigned to my team at the McGinnis House, and we worked together with a case manager and a physician and 2 nurse practitioners.
This is a place where if you need help, they're here with open arms. They don't judge here.
And we wish Bonnie all the best. When we come back, a look at how one community approached the battle against drug and alcohol abuse as everybody's responsibility and made a difference.